歡迎大家嚟到。
Welcome to the media briefing today. On the stage, we have Dr. Chong Shuk Kwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Sarah Ho, Chief Manager of TMHK. Dr. Zhang will give us an update about the cases. Good afternoon. Last night, 109 cases were recorded. Among them, 11 were imported. 98 cases were locally infected. Among the locally infected cases, 5 so far are untraceable. Also, 24 cases are linked with other cases. The remaining cases are residents in Yat Kwai Estate or those who have visited Yat Kwai Estate, including 27 from Yat Kwai House, Ying Kwai House 33, and 9 cases from other buildings in the estate. That is Chin Kwai House, Big Kwai House, Yuk Kwai House, Ya Kwai House, Chun Kwai House, Luk Kwai House, and Pak Kwai House, and Ha Kwai House. Among these cases, some are linked. Yesterday we mentioned a construction site at Victory Shingley Road. 8 cases are workers at the construction site, plus the one previously confirmed. There are so far 9 cases from the construction site. And also, at the Labour Department on the 10th floor of the Cheung Sha Wan government offices, there are 2 cases who have eaten together. There is 1 case previously from Fu Keung House. We have identified another preliminary positive case living several floors above, facing the same orientation. We suspect a vertical infection or transmission. At Wong Dai Sin, there are 2 cases from a building, Ho Yun. That is Tropicana Gardens. All 3 cases live in Flat E. They carry L452R strain, suspected to be a Delta variant case. The other case, it seems that a hamster was brought recently. We are still investigating. For Block 1 Tropicana Gardens, we are going to inspect the site together with other departments. For the untraceable cases, they are 13335. A KG5 student studying in Ho Man Tin. That's a 13-year-old student. He lives in Block 6, La Rosa A coastal line in Tung Chung. He had some activities on the podium. We had some previous cases having activities at the podium too. We're trying to find out possible links between the cases. We treat it as a link case so far, subject to our investigation. And 13340, a suspected Omicron case. He is an IT worker in the bank. He lives in Glory Court, Chun Wan Garden. This is an untraceable case so far. He went to the Panda Hotel, a noodle shop, for a meal. And he also went to the Lalina Plaza at City Walk 4 to have some activities. The third case, 13353, she lives in Kwai Yan House at Kwai Fong Estate. She is a 53-year-old female, a suspected Omicron carrier. No source can be identified yet. She goes to the Kwai Hing Plaza or the Metro Plaza in Kwai Chung. Many residents and many confirmed cases in Kwai Chung went to these shopping malls. However, no contact has been established. 13370, a 49-year-old female. She lives in Hing Fung Building, Block B, Sham Shui Po. She works at a hair salon. She works at a ground floor shop at Feng Wang San Chun in Wang Dai Xin. She went to the temple and she was subject to a test. She is a suspected Delta case carrying L452R strain. From the sewage samples, another one. That's 13382. That's one of the residents living in the Tropicana Gardens, suspected Delta strain carrying L452R. He's the first case uncovered, so he is treated as an untraceable case. The other two cases are treated as linked. That's a 75-year-old male living in Block 1 Tropicana Gardens. He goes to the Fong Duc Park for morning exercise during the mornings, 8 to 9 o'clock. Besides, not much activities. That's the traceable cases so far. From the sewage samples in Wang Dai Xin, Delta and Omicron strains are found in the sewage samples. Some cases carry the Delta strain, not so many for Omicron. We suspect there is a silent transmission chain in the neighborhood. We urge residents in the neighborhood to stay vigilant and get tested. We have set up mobile testing stations in Wang Dai Xin for the residents. That's all for my report today. Dr. Sarah Ho, please tell us about the hospital's situation. Good afternoon. As of 9 a.m. this morning, in the past 24 hours, the HA system has reported 143 cases. 30 patients have been discharged in the past 24 hours. So far, 12,602 patients have been discharged. There are still 426 patients being hospitalized in the North Lantau Infection Control Center, the Hospital Authorities Infection Control Center, and the AWE Community Treatment Center, and 8 public hospitals. All patients are in a stable condition, and there are several reports to make. First, Prince of Wales Hospital, the psychiatric wards general outpatient clinic, a nurse is tested preliminary positive. The hospital was notified yesterday that a nurse, or rather a patient who went to the GOPC on the 18th of January is confirmed to be a patient. Tracing has begun, and 31 colleagues were subject to a test. The nurse was tested preliminary positive in the test. The remaining 30 colleagues are tested negative. The female nurse last worked on the 21st of January. During work, she donned proper PPE. As a result, no other patients and colleagues are listed as close contacts. We've arranged 50 patients who, 50 colleagues who work on the 21st of January to get tested, and 5 patients who had contacts with the nurse were notified to get a test and undergo medical surveillance. To be prudent, the clinic has suspended operation for thorough disinfection and cleansing. We have notified patients to change their arrangement.
The second report involved a 78-year-old male patient who lived at Kwai Chung Estate, and on January the 22nd, he had fever and throat discomfort, and he was admitted to Princess Margaret Hospital by ambulance for treatment. Yesterday, he tested preliminary positive. On January the 17th, he visited the day chemotherapy clinic of the hospital for treatment. The infection control unit of the hospital conducted contact tracing and found that over the course of chemotherapy, the patient temporarily removed his mask and talked to a patient care assistant, and as such, the patient care assistant was listed as a close contact and had to be quarantined. Apart from this patient care assistant, no other patient or staff were listed as close contacts. To play safe, the hospital arranged for tests for 3 other staff members. 2 results came back negative, and 1 is still pending results. And at the chemotherapy center, environmental samples were collected, and the test results all came back negative. We thoroughly cleansed and disinfected the area as well. The Red Cross Services Center was informed yesterday that 2 confirmed patients donated blood earlier. One of the patients donated blood at the Chunwan Center on January the 16th at about 11 a.m. to 12, and another patient donated blood at the Sha Tin station on January the 20th between 12:42 and 1:42 p.m. Both patients did not exhibit any symptoms while donating blood, and they passed the screening. The center immediately started tracing the blood donated and the relevant products. The blood donated were separated into red blood cells, blood platelets, etc. And for the plasma, the product was used by a patient subsequently, and the hospital arranged for testing and surveillance of the patient, and the platelets and plasma products were yet to be used, and they were recalled promptly. As for the patient who donated blood in Chunwan, his blood products were unused, and the products were subsequently recalled. There was a family member for that patient who also gave blood during the same period, and again we would recall the products, and no staff members were listed as close contacts. But to play safe, a total of 20 staff from the 2 donation centers were traced, and the CHP would get in touch with these persons. And now I'd like to report another incident involving Queen Elizabeth Hospital. A 3A assistant working at the hospital tested positive yesterday while working at Penny's Bay Quarantine Center. Together with his family, he lived in Kwai Chung Estate. His main duties were to manage traffic at the hospital, and while on duty, he did not have any contact with patients. He last went to work on January the 21st, since he was a new recruit. Our infection control unit conducted a fit test for respirators, and the infection control team had appropriate personal protective gear. But since the fit test involved repeated inhalation, the test took about 30 minutes, and as such, the officer responsible for the fit test was classified as a close contact. The patient who tested positive used the changing room, and the room would be disinfected. The floor is now open for questions. Please identify your organization before you speak. The lady on the right. I'm from Now TV. There were untraceable cases yesterday. Can you give us an update on cases in which you managed to trace the origin, especially the lift maintenance worker living in Ma'anshan, since it involved the Delta variant? And I have a question about Kwai Chung Estate as well. Do you believe we are seeing an outbreak already? Is there any possibility of a total lockdown for Kwai Chung Estate? As for the buildings subject to a 5-day lockdown, is it necessary to extend this period? Some residents complained that there were long queues for those waiting to be tested. Do you see that the testing would actually increase the risk of cross-contamination? I have a question about hamsters as well. The government said that one of the hamsters surrendered tested positive for the Delta variant. Which pet shop did that hamster come from, or was the hamster not from any of the pet shops? For the cases yesterday, we do not have any updates yet, including the lift maintenance worker. As for Kwai Chung Estate, as of this morning, including positive and preliminary positive cases, there were about 210 cases, so we saw an increase, and we expect more cases to come in. As for the infection control measures, we would have to look at the caseload in the coming days and whether there's a declining trend, since there's an incubation period associated with the variant. I believe the relevant departments are trying to contain the risk of cross-contamination, and we call upon everyone to observe social distancing and maintain personal hygiene. Next question, please. For the hamster in question, it is not a confirmed case yet. For the origin of the hamster, I would have to look up the information. On January the 16th, the hamster was bought at I Love Rabbit of Mongkok, but the owner or buyer was yet to become a confirmed case. Next question. I'm from Mingpao. First of all, about the situation in Kwai Chung Estate. And you talked about the construction site in Changshan Estate. Did any preliminary positive cases arise today from this construction site? And what is the total caseload so far arising from this construction site? The Housing Department indicated yesterday that an officer from that construction site tested positive, so I'd like to know the cumulative caseload of the estate so far. As for the Manning's outlet, I'd like to know the total number of positive or preliminary positive patients who worked at Manning's. For the Manning's staff member and the customs officer, can you describe their interactions at the warehouse? Did they have masks on, and did they talk? And did any other officer from the customs test preliminary positive or positive?
What about the colleagues of Manning's? Do they share the same access to shops, or would they go to the same warehouse? And what about the viral strain for a case of a sampling officer? And yesterday you mentioned a case 13340 went to the Panda Hotel. So when did the case go to the hotel? And case 13134, who lives in Yek Kwai House, the patient also reports that he lives in the Panda Hotel. So why were there two addresses? And was he related to case 13340? And HKTV Mall, there is a packaging worker who is confirmed. So does he live in Kwai Shing Estate? What about the city value and also the risk to customers? And the Eon branch at Taiwan Hao, there is also a worker who is confirmed. Does the worker also live in Kwai Shing Estate? So let's stop here. There are quite a number of questions. The sample collection worker who was confirmed yesterday, that's an Omicron strain. He was involved in the investigation work. There were many cases in Kwai Chung, so it is possible that he was infected there, pending the genome sequencing results. Maybe all the patients in the estate carry the same virus strain, so it is quite difficult to determine what his infection source is. For the Changshan Estate construction site, there are no more. There is no new case yet. For the Manning's warehouse, there are only 2 cases so far. One worker works as the warehouse. Another disciplinary service officer also stayed a while in the warehouse. They don't know each other, and there was no contact. Because of a confirmed case, the disciplinary service officer went to carry out an investigation. Case 13340.
13134
13134. That's a case who lives in Yek Kwai House. On the 20th of January, the patient stayed at the Panda Hotel. I can't give you a lot of details for individual cases because there are a lot of cases involving different occupations. Many persons are involved, including taxi drivers, restaurant workers, warehouse staff, and so on. For critical locations, we would issue compulsory testing notices. We urge the public to pay attention to the notices and get a test according to our instruction. About the individual case details, I can't give you a lot of details. Next question. Good afternoon, Cable News. About the Kwai Chung Estate situation, more than half of the buildings have cases, and the number is only increasing by the days. So would you consider locking down the whole estate? Why is that we are not locking down the estate at present? Are you not worried that the virus would spread? And there are residents who told us that they have made arrangements for testing. However, no one reached out to them. There are people who are not mobile. However, no one is giving them a test. So for any delay, would they be fined? About the hair salon at Wong Tai Sin, how many customers have been to the salon and how many close contacts? How will you track them down? I'm not very sure about the registration for test details or home testing arrangements. So you may have to ask the relevant colleagues. For the Wong Tai Sin and traceable case, we will carry out investigation to find close contacts, the colleagues or the customers. We will try to track them down, and we will look at the situation of a workplace. If there are a lot of customers, there there might not be a registration, so we would check the credit card or autobus card transaction record. If we are not able to trace all the customers down, we will issue a CTN. An English question.
From the SCMP. My first question is that residents at Kwai Chung Estate have complained of mixing clean and dirty zones with food placed next to used protective gear. And there's also been reports of confirmed cases going down for testing. Staff also didn't follow guidelines when taking off PPE. So will these sort of exacerbate the outbreak there? Second is authorities have identified Wong Dai Sin as a high-risk area due to the positive sewage samples with both Delta and Omicron. So have there been any cases that have been there recently, and could the suspected Delta outbreak there be from animal to human transmission? As you mentioned that one of the cases may have a hamster. Third question is about Princess Margaret Hospital. There have been reports that there are a lot of staff there who live in Kwai Chung Estate. So is there a risk of bringing the virus from the estate to the hospital? And how many preliminary positive cases today? Thanks.
There are around 100 preliminary positive cases at this moment. We may receive more cases, every now and then. So I understand in the Kwai Chung Estate, the relevant government departments and also the workers there are try their best to minimize cross-infection and reinforce infection control measures. For the Wong Dai Sin, for the sewage, we have both Delta and Omicron. But for the Delta cases, we found 2 confirmed cases with a suspected Delta, and then they live in the same building. And also there's also a preliminary positive case in that building. They all live in the flat E of that block. So we are doing a multidisciplinary investigation and site visit there to see what happens. And that may explain some of the Delta found in the sewage. As for the Omicron, we have not found a major outbreak there yet, but there may be 1 or 2 cases we need to check. Yeah. In the 3 cases, one of the preliminary positive case who stay in the flat E of the building. We just note that he kept a hamster bought recently in a shop, but details we are still asking.
For those staff working in PMH and at the same time living in Kwai Chung Estate, and they are advised to stay at home, and they are given authorized leave. And at the same time, they need to honor or observe the mandatory testing as advised by Department of Health.
Are there a lot of staff living there?
We have quite a number of staff, and at the same time, we will mobilize others colleagues to help out to ensure the service will not be affected.
Hi, Thầy.
Next question. The lady on the right. Hi, TVB. Today, the situation at Kwai Chung Estate is still spreading. At Yat Kwai House and Ying Kwai House, the buildings in the area have seen at least 1 case, some even more. Most of the residents are still able to go to work and school. Is that a major risk to the community as a whole? The estate is not locked down at present, so when would CHP consider it the appropriate time to issue a lockdown order? So is there a trend of spreading from Kwai Chung Estate to the west, including Tai Wo Hao and Shun Wan? And the sewage, the positive sewage samples from Wong Dai Sin, they are Omicron and Delta strains. What's the risk? Is it a warning sign? Should we consider imposing a lockdown for the buildings involved in Wong Dai Sin? Many residents told us that from the Kwaichung estate told us that there is rubbish piling up at the building. The government promises to clear away the rubbish today. So does the CHP consider it a risk? And some residents complain that they couldn't go to work or even got sacked because of the lockdown at Kwaichung estate. So would that discourage residents from getting a test even though they have symptoms? So is there any call you want to make to the public?
村都係即係
So far, 2 housing estates have been subject to a lockdown for days, and we also saw other cases elsewhere. So we would assess whether there's an outbreak based on the results of the restriction testing declarations and testing notices, and we will consider the public health grounds. We urge patience from the residents, as we understand that such measures would bring inconvenience, and we call for understanding from employers as well. And I'm sure the employers do not want to see an outbreak either. We saw that in hospitals, construction sites, shopping centers, mannings, etc. We saw small-scale outbreaks, and at the construction site, we saw a total of 9 cases already. And this is due to the fact that Omicron is highly infectious. We are talking about a large number of residents who visited places nearby. So, and as such, it is possible that transmission took place at nearby places. Next question.
TMHK, to follow up on the untraceable case at Kwai Fong estate, are you worried that it will cause a further community outbreak at Kwai Ching district? And do you think there is a need to extend the 5-day lockdown or further expand the lockdown to other areas in the district? Also, there's one more positive case in Tai Wo Hao. How risky is a vertical transmission in the area? And for Wong Tai Sin district, how big of a risk is the residents exposed to now? And do you think the spread of virus is just at one building, or are you worried that there will be a district-wide outbreak? And also for the blood donation, is there any measure to make sure the blood donors are not infected before the blood donation? Do you suggest them to get tested before they donate their blood? Thank you.
For every case, we will try to trace their close contacts and put those places they visited under compulsory testing notice to check whether and to early detect whether there is any spread. Of course, we are worried for every case there is a possibility of further spread, especially with the highly infectious Omicron. As for whether to extend lockdown period, I think it depends on the trend of the cases in the coming days. And for the Tai Wo Hao Fu Keung, Tai Wo Hao Estate Fu Keung House, we are doing a site visit. Preliminarily, we found 2 cases with a same direction. So we need to go down and check whether there's any problem or any possible explanation of the 2 cases. And for the Wong Tai Sin district, because of the sewage problem and because we also found some Delta and Omicron in those sewage surveillance, and now we found some cases with suspected Delta. So we appeal to the residents or those who work in the Wong Tai Sin district to come to have voluntary testing as soon as possible.
For the donor, we also, before they donate the blood, and we advise them to make the booking and in advance so that to decrease gathering of a lot of people in blood donation center. And before the donation, we also have some screening questions, including whether the patients under any mandatory and mandatory testing, and also we will check the travel history, any related occupation, clustering, or any contact with a suspected or confirmed case. And out of the international guidelines or observations, we find that the blood-borne transmission of COVID is very, very low. So through the preliminary screening and also after the donation, we also advise the donor in case they have any change of symptoms or have any illness, they can contact the blood donation center, and we will help them to follow up.
下一題，呢位男士。
Next question, please. The gentleman at the back. I'm from AM 730. Question about Kwai Chung Estate. Can you give us the total number of cases at different buildings, respectively, at Fu Keung House? No positive cases was found from the lockdown, and do you see a spread at Tai Wo Hau Estate? As for the Xinglei Road construction site, which company is responsible, or what is the housing development involved, and what are the case numbers involved? For the Chengshan Estate cases, are we seeing 2 cases so far? As for the sewage samples from Wong Tai Sin, did you identify both variants from the same source? And how many how many E-units are involved? As for the cases from Tung Chung, were they related to the Tai O Fat Ho School? For the Namshan residents, for senior residents, which case numbers were involved? For untraceable cases, like I said, there were 5. As for the sampling work, the case number is 13312. As for the Buddhist school, we saw further cases. We saw 1 more case. We have 1 related case today. He came into contact with 13324 briefly. The new case carried the L452R strain. As for the sewage samples from Wong Tai Sin, they were not necessarily from Tropicana Gardens, but at Tropicana Gardens we saw 3 separate cases from the E units, and sewage samples were collected there, and both the Delta and Omicron variants were found. The speaker is not coming through the microphone. As for the construction site numbers, well, the case numbers involved with the construction site, we had 13207, 13292, 13305, 13306, 13315, 13384, 13386, 13391, and 13392. For preliminary positive cases, I don't have the numbers on hand. For Kwai Chung Estate, as of this morning, including both positive and preliminary cases, Yak Kwai House 148, involving more than 100 units. In Kwai House, 49 cases. Hiu Kwai, Yok Kwai, Nga Kwai House, Hiu Kwai House and Yok Kwai House, 1 case each. Nga Kwai House, 3 cases. Chung Kwai, 1 case. Chin Kwai House, 1 case. Choi Kwai, Lok Kwai, Bak Kwai, 1 case each. That's the approximate breakdown, but these numbers might continue to evolve as more test results become available.
Any more questions? The lady at the back. Good afternoon, Hong Kong Economic Times. Today, the untraceable cases, what are their city values? What about the KGV Homerton School's student? When did he last go to school, and what is his virus strain? The IT worker at a bank, which bank is it? And did he come into contact with the public during his work? the 10th floor labor's department's office at the government offices. Do the two cases work together, and where did they eat? Is there a risk at the restaurant? About Tropicana Gardens residents, he bought a hamster. When and where? And you said today there is a link case with case 13324. The hamster buyer who met briefly with him. So does case 13324 live in Yat Kwai House? And the Shingley Road construction site, how many construction site workers are under quarantine? And you visited Ming Star Seafood restaurants. So is there a result? And a question for HA, the psychiatric nurse at Prince of Wales Hospital, did she come into contact with any patients? What about the patient? Was he wearing a mask? And blood donor, the blood donor patient, is their case number Omicron or Delta? And what's the infection risk for the blood transfusion recipient? For the Shingley Road construction site, investigation is still ongoing. Some cases work on the first floor. We are confirming whether all patients work on the same floor. The bank. He is an IT staff. That's a back office staff. The KG5 student, he last went to school on the 21st of January. His city value after hospitalization was 21. The Labor's department's office patients. One is a security officer at the Labor's department. The other is a civilian staff or clerical staff at the department. They ate together. About the bank, it was the Amundi Hong Kong. On the 14th of January, they went to Cafe Red at Dragon Palace. They share the same table. The restaurant was required to undergo thorough disinfection, and all staff members have to undergo testing and quarantine. Tropicana Gardens, that's a preliminary positive case. No case number yet. We are investigating where the hamster was bought and when. The Dragon Palace restaurant is Cafe Med. That's Omicron strain. Yes, Omicron. Dr. Ho, about the specialist outpatient clinic of Prince of Wales Hospital, the patients wore a mask. No high-risk procedures were carried out. Our colleagues wore proper PPE. Still, there are many cases in the community with unknown source. The CHP is still tracing the source. On blood donation, according to medical journals, infection of COVID-19 via blood transfusion is very low. We had a case. A French blood donor was confirmed However, the transfusion recipient was not tested positive afterwards. No virus was found in his body. Do you mean the new case? That's a case 13367. Any more questions? One more question. About a number. When you mentioned the Kwai Chung estate, you said the accumulated number is 210. However, it seems that the number is higher than that. Can I confirm the number with you? In several days, there are already some 200 cases in Kwai Chung estate. So how would you describe the situation? Well, it depends on the calculation method. Maybe we have different cutoff times. The number is still fluid. We will give you a new total tomorrow. The Omicron virus is very transmissible with very short incubation period, 1 to 2 days or even shorter. If infection is ongoing, we expect an exponential growth of case numbers. The number is rising, however, it is not as bad as we have expected. Because of the brief lockdown and the disinfection, hopefully we may control the outbreak and the number would go down again. That's the end for the media briefing. Thank you.